So, hi everyone. Great to get started. Just giving a few minutes for everyone to log in. We're starting a few minutes behind, but we're going to catch up over the day. So it's cool you're all here. Thank you for joining us. Thanks especially to Professor Neary in Waterford for putting together this program. We're on the 5th annual University Hospital Waterford video surgery webinar. And excitingly, actually, we're going to starting this time with an ICG study day, more like maybe 90 minutes, and we're going to bring you right up to date with where ICG is. I think we'll get some outstanding presentations from Mr. Ishtiaq and Mr. Devane regarding biliary and colorectal applications for this. I'm going to chat to you a little bit about AI and how that works with Indo Signing Green. But I hope you're going to see over the next hour, 90 minutes or so, how excited we are about this technology. It's really, I think, reached now a stage of evidence. That means it should be implemented into people's practice. And I hope we're going to convince you of that. It's great in a small crowd. We're all friends here. Great if you will interact, ask some comments, ask some questions, challenge the speakers, and let's see if we can make sense of this for how this sort of technology works broadly in Ireland. So I'm going to start. This is near-infrared fluorescence angiography. ICG is an approved safe dye that's available now via your pharmacies. It's given intravenously, circulates through the body, and then we use near-infrared cameras to see the dye wherever it's present. So initially it goes through the circulation phase. It can be used then for perfusion assessment, and then it's excreted in the bile, and it will really nicely map out the biliary anatomy. It's been around for 60 years. It's really a very safe dye, and all the major surgical imaging companies make cameras now that can identify it, and we can chat about those applications as we come. So you'll see it wherever it's present. Here you see we've given it to this patient via cystoscopy and injected it into the ureters in a man before having a reversal Hartmann's procedure. And you can see that it's mapping out the ureters pretty nicely. So that's a specific application of ureteroscopy injection of the dye into the ureters. If you give it intravenously, though, it maps out perfusion very nicely. And here you see it in the colon, just prior to us making a proximal transection across the descending colon in a patient having an anterior resection. And this sort of checking of perfusion has been shown to be associated with reduced anastomonic leak rates, which Liam's going to be talking about in more detail. That's the proximal transection. You can also give it a distal transection. And you see here in this patient, we've also previously given it up the ureters for mapping out the anatomy of it in this case. Here you see a quick preview of it in laparoscopic cholecystectomy. It's excreted unchanged into the liver and then into the bile. And you'll see then that you can see this cholangiogram type appearances during the operation. And Asam is going to talk you through all of that specifically and in detail. Here you see Phil McEntee using the camera, but just draw attention to the monitors. You'll see here, this is a way we're working on of an AI oriented interpretation of that dynamic green appearances. And we're going to finish up the presentation talking a bit about future directions of this digital imaging technology. So this is what it's going to be about. Cameras are available now that show us both the white light, RGB image, but have this superimposition of a near-infrared, an extra layer of imaging of anatomy, physiology, and even pathology to make for better surgery and better outcomes for our patients. So it's a very quick overview, but Asam, you're going to talk next about, you've got the biggest experience of laparoscopic cholecystectomy and ICG in the country. It's available in Whitfield. People can come see it maybe anytime, any surgeons wanting to see a master in action with this, but over the next 30 minutes or so, he's going to detail his experience of that. So Sam, it's great you're here. Thank you very much.
Thanks, Prof. Setting the scene and explaining the technology behind it. So I'm just going to start off basically from the basics. So I did my first cholecystectomy almost 31 years ago, not far from this theater up in Theater 7 in Waterford Regional Hospital, where I was a trainee registrar at the time. Cholecystectomy, those of us who have been around know that while it's an intermediate procedure, very quickly and very rapidly, it can become a major event. Either you have a bleed or you have a bile leak and you're in problem. I have transitioned from open surgery to laparoscopic, and you guys are probably now from laparoscopic to AI-assisted image-guided precision surgery, etc. At the time, in 1994, when I was being trained as a registrar in surgery, Professor David Butcher Hayes had carried out Ireland's